Good morning, everyone. Thank you so much for joining us here joining us at IEI Integrated Employment Institute. My name is Mandea Nuhu Suleimana, and I'm here with my colleague Jill Valiant, and we are here to share with you about putting our own mask on first before addressing multiple domains of self-care for mental health providers. So this training, it's going to provide you with some information, some strategies, and we're going to discuss the 6 domains of self-care. So the objectives for this training, for this webinar, is to define what the 6 domains of self-care are, identify areas of strength and those for increased self-development in your own self-care practice. And we're also going to describe strategies for self-care within each domain and develop a self-care strategy.
So before we get started and really dive into that agenda, we just want to invite you to take a moment for a brief mindfulness activity. So if you are looking at your screen, you can take a look at this nice image of the forest. And we're just going to do a few moments of a breathing activity called 4x8 breathing. So in this practice, you're going to want to inhale for a count of 4. So inhale 1, 2, 3, 4, and then exhale out for a count of 8. 1, 2, 3, 4, 5, 6, 7, 8. So just go ahead and take a moment here to kind of focus in on your own breathing, follow your own breathing pattern. This practice helps to stabilize your nervous system. It can be a really helpful strategy to ground yourself. And as we're preparing to talk about self-care, what better way to start the conversation than to take a moment for mindfulness? All right. So moving along into our content for the day, start with just taking a moment to think about what burnout is. You're going to hear us talking today about a tool called the ProQual, which is the Professional Quality of Life measure that was created by the Center for Victims of Torture, actually. So they identify burnout and define it as being characterized by feeling emotionally depleted or drained, and it can result after a period of long-term work-related stress. Holland et al. Note that burnout is considered an occupational phenomenon and that it is suggested to develop as a result of ineffective coping with job-related stress. They also note that risk factors that impact burnout include the hours worked, with a greater number of hours being spent in administrative work and paperwork being associated with increased burnout. Also, a degree of perceived control over work demands is associated with burnout. If you don't feel like you have a lot of control, you're more likely to experience burnout, while having support of your peers in your workplace and your supervisor are protective factors against burnout. So diving a bit deeper here, just thinking about where we see burnout, and we know that it's pervasive throughout healthcare domains. So it's not only within the mental health field, but all healthcare domains do experience it, and that burnout and your feelings of well-being as a provider of service are associated with not only your own kind of quality of life, but also with patient care, quality, and safety. And there are countries that even include self-care as part of their ethical guidelines because they've really acknowledged that practitioners taking care of themselves is essential for good practice. Some of the components include emotional exhaustion, depersonalization and cynicism, and feelings of inefficacy. So now that we have an understanding of what burnout is, what its impacts are and some of the costs associated in terms of patient care and quality and our own turnover, which a lot of us are experiencing in our programs, right? We want to take some time to think about self-care. So what we know about self-care, it's defined as attending to one's own holistic well-being, and that it involves self-reflection and action in terms of knowing your own needs and making a conscious effort to seek out resources that will foster health and well-being. And that definition comes from Paslin and Gall, and they have an article published that is an evaluation of the literature on self-care, and that's where this framework that we're going to be discussing with you today has come from, and the domains of self-care that we're going to be diving into. So just taking a moment to think about for yourself what comes to mind when you hear the term self-care, thinking about some of your preferred methods for self-care, and thinking about what gets in the way of your efforts to properly take care of yourself. There's a quote here that says, "Exhausted when saying yes, guilty when saying no. This tension is between giving and taking, between other care and self-care." So as we move through the content today and really dive into these domains, just taking a moment to keep in mind your own preferred methods, the things that get in the way, and how to maybe strategize building them into your life a little bit more purposefully. So when we're going to be looking at these domains, this article from Paslin and Gall, these are the domains that they have identified as being the domains of self-care. So we have awareness, balance, flexibility, physical health, social support, and spirituality. And as Mandaya noted, we're going to take a moment to kind of go through each one, talk about what it looks like within the mental health field, and some strategies to develop self-care practice in these domains. So we're going to start with awareness. There's a quote here from Jon Kabat-Zinn, who was the founder of the mindfulness-based stress reduction program, saying that mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. So what does this look like in the behavioral health field? So in the behavioral health field, awareness can look like having knowledge about the field of work, such as understanding the risks for and symptoms of burnout and professional impairment, holding realistic expectations about the nature of the work we do and the skills to assess the effectiveness of this work, and having the capacity for reflection on internal and external experiences and the monitoring of our own needs. So strategies to address self-care can include acceptance and commitment therapy. So this particular methodology is based in cognitive behavioral therapy, and it incorporates mindfulness and acceptance practices that are related to your values-oriented goals. So those values that brought you into this field in the first place. Also, strategies included under self-care strategies for awareness are mindfulness and meditation training, which can be some breathwork practices, other meditation, yoga, mindfulness practices, and creative writing. From here, we go into the domain of balance. So balance is defined as distributing one's attention to various aspects of life and maintaining a sense of equilibrium in both personal and professional realms. So inviting you, as you are watching this recording or listening to it, to thinking about how important you would rate balance to yourself on a scale from 0 to 10. So reflecting on that for a moment, how important you think balance is, and then thinking about how well you currently practice balance. So are you practicing balance at the same level to which you think it's important? And if not, thinking about how you might be able to address that for yourself. Some strategies for improving balance in your own life could be to make sure that you take time for leisure time. That can include very literally adding it into your calendar, right? Thinking about cultivating interests and passions outside of work, seeking out variety in the tasks that you're taking on within your professional work to whatever degree that is possible for you, making sure that you have really solid boundaries so that you're able to take time for yourself and to hold that balance, and having a holistic view of well-being, thinking some about the 8 dimensions of wellness, the occupational dimension is only one dimension of the entire wheel of holistic wellness. And finally, just this quote here from Brene Brown, where she says, "It takes courage to rest and play in a culture where exhaustion is seen as a status symbol." And it's really important and essential to our ability to provide good care, to make sure that we're taking time for ourselves.
Thank you so much, Jill. So, with having balance can help you develop flexibility, right? So flexibility is important and is one of the domains of self-care, and it's very important. So according to Paulson and Gall, flexibility refers to a number of dynamic processes that include the practitioner's utilization of effective coping strategies and openness and ability to grow from life stress. So, research has shown that practitioners who have a rigid view of engaging and practicing and rigid view of how the therapeutic process should go, or expectations of what they need to do, can reduce self-efficacy and also professional growth. So let's take a minute to reflect on these questions about what does flexibility mean to you, and how would you measure having flexibility in your role as a mental health professional? So now we're going to discuss the self-care strategies for flexibility. So some of the self-care strategies for flexibility includes engaging in professional development and on a regular basis, right? Also realistic self-expectation. So let's talk about engaging in professional development on a regular basis. So when we're able to go for training, or that has to do with the work we do, or even such as the self-care, it kind of almost like you go back into awareness. You're kind of like, you're aware of either what you're like, for example, how much self-care you haven't been doing, or, professional development in the sense of practicing skills and strategies on how to support the individuals you're working with. It kind of like either validate some of the things you're doing, or answer questions, or fill in gaps of things you're not sure of with delivering services to the individuals you support. And having realistic expectations, we need to understand that we are not superheroes and we cannot save everybody, or we can't expect the relationship, the therapeutic relationship with the individual should just happen the way we would envision it. That's perfect way. Just understand that there may be resistance, or certain things are out of your control, and the only thing you could do is to support the individual and being able to adapt. I know sometimes we may have a planned schedule, and especially for those individuals who work in direct support, and you feel like you have a list of things. I'm going to do this from 8 to 9, from 10 to this, and then you come into the program and crises are happening and everything has changed. Being able to adapt and like, okay, it's okay, I may have planned this, but this is what happened. And having self-compassion and acceptance. So we, in our field, we're like helping everybody else. We're showing compassion towards everybody else, but sometimes we do forget to do that for ourselves. So it's important that we understand that it's okay to just take some time for ourselves and acceptance. And I think it's very important in that area. That area is very important. Being kind to ourselves. So the next self-care domain on physical health, which is a very important part of our, the self-care domain, is self-care in relation to physical health, encompasses of the focus on issues of sleep, exercise, diet. I know that most of you, or almost all of us, have experienced lack of sleep and not being able to exercise the way we would want because of work and other things that are happening in our lives, or being able to have a proper meal, like a good balanced diet. Why? Because of, again, it could be the work we do and we may just grab chips or soda or juice, we may not actually have enjoyed a real meal. So what are some of the physical problems as a result of lack of having that in self-care? That includes fatigue, which we've probably experienced, either some of you, most of us, or either all of us. Headaches, back pains, irritable bowel movements, are all problems associated with physical health problems due to lack of self-care in that area. So let's discuss some self-care strategies for physical health. So sleep hygiene, being able to, sleep hygiene, meaning having self-monitoring sleep habits, maintaining a regular sleep schedule, avoiding going to bed hungry or thirsty. So having a sleep schedule, like every day I'll go to bed at 9 p.m. or 9:30, I think it's great because then your body gets accustomed to it. It may not stay later than that time, or your body may not go to sleep earlier than probably 9 o'clock. It depends on what your schedule is. But being able to say that at 9 or 10 or even 11, it's my bedtime. And no matter what I'm doing, even if it had to do with work, I'm going to stop and get my rest, right? And not going to bed hungry or thirsty. What happens when we go to bed hungry or thirsty? Oh, I know for me, I've woken up because I'm like super thirsty. And that is so painful because once I wake up, it takes forever to go back to sleep. So just keep making sure that you keep yourself hydrated. Even if you don't want to eat a big meal, eat something and, keep yourself hydrated, and having a balanced diet and exercise. Balanced diet is important because you get your essential nutrients and vitamins and minerals, and also exercising. You go out. I know for me, when I go outside to take a walk and I come back, I feel like a new person. So just being able to take our time to exercise, it can, increase our, self-efficacy, can make us less stressed. You feel like less exhausted and all of those good things, and lower rates of burnout and greater quality of life, higher quality of life. So now let's discuss social support, which is also a very important area. I mean, all the 6 domains are extremely important part of self-care that we need to, care for. So social support refers to, according to Pausans and Gall, the resources and interactions provided by others and or concentration to others that help cope with stress circumstances that can come from a variety of sources, such as family, friends, coworkers, and supervisors. So social isolation is a risk for burnout among mental health professionals and service providers. So why it's burnouts, could isolation be a risk factor? So it can happen in so many different ways. Now that some of us are able to work from home, there are individuals that can work from home, or, and when working from home can increase that, because unless you either meet over meetings, you're not actually in that in person like we used to during COVID. So work has kind of changed in the sense of being around people. So that can also contribute to burnout, because not having that outlet, those social connection of support, you just like keep everything in, or, overwhelmed with so many different things. So let's discuss some self-care strategies for social support. So personal support, such as friends, family, and personal therapy, could lead to would promote life balance for the practitioner, right? So when you have your friends, your family, you go to therapy, you have friends and family you could talk to who are positive. Just so we remember, these are positive people in our lives you could talk to, and they're either affirming, they're supporting you. Your therapist is objective about things, and that could help you feel like, okay, I'm stressed, but when I go see my friends or my family or my therapist, I feel better, right? Okay, so lower levels of perceived stress and greater self-esteem, lower anxiety, depression, and less use of avoidance coping strategies. And for professional support, which includes clinical supervisors, mentor, advisors, professional colleagues, and peers and professors, having this support, social support, could lead to stronger working alliance with the individuals and higher treatment satisfaction. Why? Because I know when I go for supervision, I come out feeling like a new person and I can save the world, and I apply whatever I get in supervision and it comes out successfully. So also life and daily balance, being able to having that, you're able to balance work and life, right? And cognitive awareness. You're more aware of maybe what may not go too well with your support, or how you can support the individual, and just knowing that doing your best is all you can do.
Thanks, Mandaya. And now for the final domain of self-care, we're going to be talking about spirituality. So just taking a moment to think about what spirituality means to you, right? So different people have different spiritual practices, different belief systems. Overall, we think of spirituality as the search for the sacred in one's life, and there's a theme around connection when we talk about spirituality. So spirituality involves the recognition of a feeling or sense or belief that there is something greater than myself, something more to being human than sensory experience, and that the greater whole of which we are a part is cosmic or divine in nature. And that quote is from Dr. Maya Spencer. So really, spirituality comes down to that theme of connection and purpose and meaning. So self-care strategies for spirituality can look different for different individuals, just as all of the other domains. So one might be connecting with nature or mindfulness practices, taking time for reflection on the meaning and purpose of our work. If you are a person who identifies as religious, then prayer may be a part of your spiritual practice as well. So putting all of these things together into a self-care action plan, thinking about like the goal plans that you may create as you're working with individuals, right? Thinking about that for yourself as well. What's your overall self-care goal? What steps do you need to take to get there? So thinking about what you currently do well, starting with strengths is always a good place to start with. So what do you think you currently do well in terms of your self-care? What area or two areas or practices would you like to build into your life to improve your own self-care? Thinking about how you will do this. Thinking about who will support you. So kind of going back to that idea from the social support domain, who in your circle can be helpful for you? Is it your supervisor? Is it a peer? Is it your partner? Thinking about how you can have some support there. We also invite you to look at the ProQual website, both for the measure. There is a really great measure that you can use to assess your own current levels of compassion satisfaction, compassion fatigue. And there are also a lot of really great resources on that website for self-care strategies in different domains, including a lot of the things that we went over today. So we really invite you to take some time to look through those tools and resources.
Okay, thank you so much, Jill. So a summary of today's training on on self-care is that we looked at how we as mental health professionals, how we tend to give more of ourselves and neglect our self-care, which negatively impacts us in many ways, such as our self in the areas of awareness, spirituality, balance, flexibility, physical health, and social support, which are areas that can help decrease burnout, right? And engaging in healthy forms of self-care can promote overall physical and mental well-being. And developing a self-care plan, which we've provided excellent resources, can support you in ensuring that you put our own oxygen masks on before we go out to support the individual that we help, which just helps, safely helping them put their own oxygen mask on. Thank you so much for attending today's training. We also have resources that and references that you can check out, which are excellent. And this is our contact information. Jill and you can reach us at our email addresses, and we'll be more than happy to assist. Jill?
Thanks for coming, guys.
Thank you, everyone. Have a great day.